para...
Okay, I will knock on the door. Hi, my name is Claudia. I'm gonna be your nurse for the day. What's your full name and date of birth?
Hi, Claudia. My name is Aisel Diaz. My date of birth is August 19, 2001.
Perfect. How would you like to be addressed today?
You can call me Aisel.
Okay, Aisel. What brings you in today?
You know, I'm just wanna like keep in my, to know if I'm like healthy since I play sports. So I just wanna know how I can like do better with my health.
So today I will be doing a head to toe assessment on you, if you consent.
Yes, you can assess, you can help me. That's what I'm here for.
Perfect. So the reason for this is just to get a better view of your overall health. At this point, I'm gonna wash my hands, I'm gonna provide you with privacy, and I'm gonna put in some gloves.
Thank you.
Of course. Do you have any medical condition that I may know?
No, I don't have any medical conditions.
Okay, any medications that I need to know that you're taking?
No, I don't take any medications.
Perfect. Do you feel comfortable at this moment?
Yes, I do.
Perfect. Do you need to go and use the bathroom before we start, since we're gonna be doing an abdomen assessment?
No, I already used the bathroom. Like,
Okay,
I don't need to.
perfect. You're prepared. So at this point, I am going to take your vital signs. All my equipment, it's already sanitized. Okay, I'm gonna get my equipment. We will start by checking your blood pressure and making sure your arm is supported while I'm taking it. We're gonna use the stethoscope. And the blood pressure supposed to be taken with a manual blood pressure, but at this time I don't have one on me, so I will explain how to do it. So it's the same thing, putting in the cuff on the arm, making sure it's well placed. Now, when I have my cuff on, I will palpate the brachial artery. Once I locate it, I will place my stethoscope over the brachial artery and I will start inflating my cuff. Then I will inflate the cuff 20 to 30 millimeters of mercury higher than her pulse. Once I have that, I will release the pressure and I will listen for the cardiac of sounds. And that will give me the reading of the blood pressure. Now I will go ahead and assess her respiratory rate, which it's normally assessed in 60 seconds, while trying to be discreet so the results don't fluctuate. Now I'm gonna check her pulse. I normally check the pulse for 30 seconds and I'll multiply it by 2 if the pulse is regular. I'll check it for a complete minute if I notice that her pulse is irregular. All right, so now we're gonna start by inspecting her overall appearance. Her appearance looks appropriate. I'm looking at her head. Her head is normocephalic, it's symmetrical. I'm gonna palpate for any pain or tenderness. Do you feel any pain or tenderness right now?
No, I don't feel any pain or tenderness.
Perfect. Okay, now I'm gonna assess her mouth. Open your mouth for me. Okay, now I'm gonna assess for her gag reflex. So you're gonna open your mouth, under the tongue. Okay. Gut reflex is active. Now I'm gonna assess for her any drainage or tenderness in her ears. Any tenderness?
No.
Okay, no tenderness or no drainage found. Now I will assess for her facial movements. I'll be checking for her that her cranial nerves are intact. So you're gonna raise your eyebrows for me, smile for me. Now blow up both of your cheeks. Good. Now we're gonna assess for sensation. So I'm gonna touch your face with a sharp object and a soft object.
Okay.
With your eyes closed, tell me what you feel.
Sharp. Soft. Sharp. Soft.
Perfect. Sensation is intact. Now we're gonna check your eyes. You're gonna look up for me, look down. Now you're gonna follow my finger. Good. You're gonna look here at this finger, and then I'm gonna check your pupils. Your pupils seems to be equal and reactive to light accommodation, which that is a good assessment. Now we're gonna check your acuity, visual acuity, and you're gonna read this first line here.
Discharge instructions.
Perfect. Patient has good visual acuity. Now I'm gonna go ahead and assess your lung sounds. So for the lung sounds, every time I touch you, just take normal breaths. Okay, now we're gonna assess your vocal sounds. So every time I touch you with the stethoscope, you're gonna say the sentence, blue balloons.
Okay. Blue balloons. Blue balloons. Blue balloons. Blue balloons. Blue balloons. Blue balloons.
Perfect. Now I will go ahead and check your tactile fremitus. So you're gonna turn a little bit to this side, and every time I touch you with both of my hands, you're gonna say the word 99.
99. 99. 99. 99.
Perfect. Normal tactile fremitus. Now I will go ahead and check for heart sounds. But before I check for heart sounds, I will notice her chest, and her chest is rising symmetrically. There is no skin breakage. Her skin is moist and intact. And tell me if you feel any pain when I palpate.
No, I don't feel any pain.
Perfect. Now I will go ahead and listen for heart sounds. Patient has normal heart sounds. Now I will assess your pulses. And while I am assessing your cardiac pulses, I will also be assessing your neck.
Okay.
So here we check for the cardiac pulse here, and then on the other side, they both are normal and equal. Now we are gonna assess the trachea, check for any masses or any tenderness. There's no masses or tenderness, do you feel any pain?
No, I don't feel any pain.
Okay, at this point, we're also assessing for the lymph nodes. So we have mental, submandibular, we have superior clavicular, and subclavicular. Any pain?
No, no pain.
No pain and no tenderness when assessing the lymph nodes. Now I will assess the rest of your pulses. Let's see, brachial pulse, radial pulse, and let's check your pedal pulses. They're all normal and regular on each side, equally. Her skin is warm Let's check for the capillary refill. It's less than 3. Same on the feet. Okay, now I will assess your spine. So I'm gonna ask you to please bend over for me. And I'm gonna palpate your spine. I'm looking for any curvatures. There is normal curvature. Do you feel any pain while I'm palpating?
No, I don't feel any pain.
Perfect. And go back, sit down for me. Her range of motion is normal and without pain. Now I'm gonna assess your muscular system. So I'm gonna palpate all your extremities. Let me know, and joints, and let me know if you have any pain.
No, I don't feel anything.
Good. No pain, no tenderness, no masses noted. Her skin is moist and intact all over her body. Now I'm gonna ask you to please put your arms like this for me forward, and I'm gonna assess your strength. I'm gonna push down and you're gonna resist to it.
Okay.
Good. Now I'm gonna do the same thing with your legs.
Okay.
Good. All right, so you have very good strength. Now we will go ahead and assess your stomach. You're gonna lay down for me. So while we are assessing the stomach, we must ask our patient, which it was already done at the beginning of the assessment, if they need to use the bathroom, since it may influence the results on the assessment we do. I will provide my patient with privacy, which at this point she is already covered. But if the patient had a gown, we would put a blanket on the lower extremities. So at this point, I will first assess and inspect her abdomen. I'm looking for the appearance. Her appearance is flat, normal skin color is normal to ethnicity, no masses or skin breakage seen. Also no distension. So next step is to auscultate. Patient has normal bowel sounds. Then I will go ahead and palpate her abdomen for any tenderness. Do you feel any pain when I'm doing this?
No, no pain.
No tenderness, no pain, no masses noted, no distension, and no fluid shift. Okay, you can put your shirt down. I'm gonna ask you to sit down again for me. And we're gonna assess your gait. So you're gonna stand up for me.
Okay.
You're gonna start from here and going forward, and you're gonna come back so I can assess your gait. Do it one more time for me. Perfect. And you're gonna stand here for me so I can see that her gait is normal and has a steady gait. Now I will go ahead and assess the Romberg test. So I'm gonna ask you to please put your arms on the side and close your eyes. So I can see that she is able to stand on one point. Her balance is pretty good, so that indicates that she has a negative Romberg test. Okay, you can sit down again. Okay, so now I will ask you some questions.
Okay.
We already talked about any medical conditions that you may have, and you say you don't have any,
No.
correct?
Yeah.
No medications that you take?
No, no medication.
Okay. How do you do on your activities of daily living?
What activities? What?
So that means, for example, basic things that you do during your daily life, like waking up in the morning, getting out of bed, going to the bathroom, washing your face, taking a shower. It could also be going to the kitchen, make you a coffee or breakfast.
Oh yeah, I do everything on my own. Like I have no
Perfect.
problems doing that.
Do you have any disturbances or occurrences in your life that may affect that?
No, I don't. No.
Good. Any anxiety at the moment, or have you ever suffered from anxiety?
No, no, never.
Good. What are your coping activities?
So playing sport, going out with my friends, family, yeah, I would say
Good.
those.
Good. So you're an active girl.
Yes, I am.
Very good.
Very active.
Very active. Okay. And do you have eating like healthy habits?
Yes, I think so. Sometimes, I would like to get like some burgers once in a while. But for the most part, I eat like fruits and
Perfect.
veggies.
That's important, balance. So, do you have any stress in your life right now?
No, I would say normal stress like school, like, but nothing that will interfere with my activities.
Perfect. Okay. Have you had any suicidal ideations?
No, never.
Okay. So overall in this assessment, I noticed that you're a very healthy girl. And based on your answers, I can see that you take care of yourself, you eat healthy, and you have some physical activity in your life and some coping methods for the stress in your life. I would just recommend for you to keep, doing what you're doing, keep eating healthy, keeping active in your life, have coping strategies to manage the stress, and that's it.
Thank you.
Of course.
I appreciate
it was a
your
pleasure assessing you today. Do you have any concerns at the moment?
No, I don't have any questions.
Perfect.
Right now. Yeah.
Okay, have a good day.
Thank you.